This morning, David Cameron was at the Royal Salford.
Hi there, how are you? I'm the urologist here.
It's one of the few hospitals nationwide trying to provide the same level of care on a weekend as it does Monday to Friday.
It's a bit about choosing your shifts.
Essentially, that means consultants, who usually have Saturdays and Sundays off, will have to be on the ward.
We have to realign how we work so that it is commensurate with the needs of patients. And so the way in which care is going to be delivered in the future will be different. And so I've experienced this for a long time in A&E medicine, that my days off may be during the week, for instance.
Cameron picked the Royal Salford because a 24/7 NHS is exactly what he's promising, should he get elected again.
With hospitals properly staffed, especially for urgent and emergency care, so that everyone will have access to the NHS services they need 7 days a week by 2020.
The pledge isn't exactly new. NHS England announced it last year. But with Labour putting the NHS at the forefront of their campaign, the Tories need healthcare initiatives that people will vote for. Politics aside, there's a question about how deliverable this policy is. In their 2010 manifesto, the Conservatives said they wanted 7-day-a-week GP surgeries. Well, we came to the nearest walk-in clinic to Channel 4 News HQ across the road here. And at 1 o'clock in the afternoon on a Saturday, they're turning patients away because they're full to capacity.
There's nothing open, so it's quite hard to find medical assistance on weekends, and it's hard to, I mean, it's pretty much like you have to take a day off during the weekdays to be able to get help.
Do you think the National Health Service works well enough on the weekends?
It doesn't work well at any time.
And only in Islington do patients include stars of stage and screen like Kenneth Cranham.
Even Waitrose winds down at the weekend. I don't know. I mean, it seems to be an odd thing to say. I mean, I think what you've got to sort out is how the thing is funded.
GP Louise Irvine is a candidate standing against Health Secretary Jeremy Hunt on May the 7th.
Well, they've already said that there's going to be £30 billion of so-called efficiency savings over the next 5 years. That is going to translate into frontline cuts, and that's what people are going to feel. Patients are going to feel that. Doctors like myself are going to feel that too. And we don't want to hear all these empty promises. We actually want to hear a commitment to proper funding.
So if you care about the NHS, watch this space and try to stay well in the run-up to the election. You'll likely have the same chance of seeing a campaigning politician in your local hospital as a doctor.